the Association of Certified Fraud Examiners. Together, reducing fraud worldwide.
Kickbacks are like you scratch my back, I scratch yours, which is, I guess, a long, old type of fraud. And in healthcare, it works really well because the physician wants a certain number of patients, and say another supplier, maybe an X-ray provider would like some, and so they kind of go in cahoots and say, okay, well, I'll send you patients, and for every patient that I send you, you can give me, X amount of dollars, and vice versa. If you see patients from, your end that are going to other providers, you send them to me, and, they just go back and forth, and this extra money exchanges hands with, no rhyme or reason and no documentation. Relationships. You look at the relationships with the different providers, because they're not going to be the same specialties. So if you see, things going on with diagnostic centers and physicians, or outpatient rehab centers and, physical therapists, there's going to be a relationship in there, and you can kind of gauge, if you see this person in the office, every single week, it's like, what's going on? Why is this person here all the time? So you can kind of see it from the inside. From the outside, it's a little bit more difficult. Upcoding is getting paid more for what you actually have done. So there's a good example. A few weeks ago, the Carolinas healthcare system was ordered to pay $6.5 million because of something as small as a urine test. So they provided urine tests for their patients that are based on complexity. So it's an easy urine test or more complex or a culture. And as it gets harder, you get paid more because it's more work. So they build these tests for urine tests that were of moderate complexity. They build them as high complexity. So the difference is $80 per test. So they did this over years of getting an extra $80 for every single test that they did. And now they're paying $6.5 million back to the government. You can look at the analytics. They have, especially Medicare, they have metrics that shows kind of the flow of what the nation is doing as far as, how many levels of this and how many levels of that. And if you're really above that level, that gives them something to look at. And then they can look at the particulars and say, okay, why is this, hospital system, why do they have patients that need this test so often as opposed to another hospital, that may have, 100 a year and they have 5,000? It's kind of a red flag. And so the analytics really helps that, and whistleblowers, of course. Unbundling. An easy example of unbundling is with lab tests. So you're not feeling well, the doctor has an idea of what might be wrong with you, but they need to run several tests. And so in coding, since the doctor usually will use the same kind of tests for the same kind of problem, there may be, say, 10 or 12 tests to try and determine what's wrong with you. So in coding, they've come up with one code for the 10 tests. So the doctor orders this panel of codes, which are all 10, to figure out what's wrong with you. One code, you get X amount of dollars. In unbundling, you bill for each code separately, each test separately, and then you're getting a lot more money because you get paid for the test for the prep work as well as running it. But with the panel, you're only collecting one sample of blood, so there's not 10 different preps. So in that way, they get a lot more money, and it's definitely fraud.